Hi, today I want to share with you a deeply restorative therapeutic practice, simple in technique but powerful in its physiological impact. This method can help reduce anxiety, improve the quality of your sleep, support immune resilience, restore vitality, and yes, it can even play a pivotal role in improving blood flow, including circulation to the lower body and genitals, profoundly enhancing male sexual health and function. By the end of this session, many of you may notice a calming of the mind, a sense of lightness in the body, and perhaps over time, better sleep, fewer stress hormones, and stronger, healthier erections, especially in the early morning hours, a hallmark of good vascular and hormonal health in men. Before I begin, I have an announcement to make. I'm excited to announce that I'll be offering free online consultations to my viewers from anywhere in the world, no matter where you're watching from. The selection will be done completely at random using a number generator. To participate, simply comment your lucky number between 1 and 200 below. While you're there, hit the like button, subscribe to the channel, and share this video with someone who could benefit, because the more active you are, the stronger this community becomes. Don't wait, drop your number now and try your luck. Let me explain how this works. This technique is based on a combination of traditional acupressure points and modern physiological understanding. We'll be stimulating key meridian points, originally mapped out more than 3,000 years ago in traditional Chinese medicine during acupuncture, but today applied through finger pressure in a method known as acupressure. These meridian points closely align with anatomical regions rich in nerve endings, blood vessels, and fascial communication pathways. When stimulated correctly, they activate important feedback loops within the nervous system. Specifically, we focus on activating the parasympathetic nervous system, your body's rest and repair mode. From a modern medical perspective, when we activate this system, we lower heart rate and blood pressure, regulate stress hormone release, and shift the body away from sympathetic overdrive. This is absolutely essential when it comes to vascular health, sexual performance, and erectile function. Let me be very clear. Chronic stress, poor sleep, shallow breathing, and nervous system imbalance are some of the most underestimated causes of erectile dysfunction, ED, in men today. If your body is constantly operating under low-grade mental or physical stress, blood flow to non-essential regions, like the genitals, is reduced. Your brain prioritizes survival, not reproduction. This is why so many men who are under stress, not sleeping deeply, or living in a state of muscular and psychological tension begin noticing changes in their libido, difficulty maintaining erections, or a complete absence of morning erections, technically known as nocturnal penile tumescence, which is a natural and necessary process for penile tissue health. However, by activating the parasympathetic system, increasing nasal breathing, improving oxygen delivery, and stimulating these key nerve points, you can literally and immediately start improving circulation, head to toe, including to the pelvic region and genitals. In fact, clinical studies have shown that good sleep and parasympathetic dominance are directly related to improved nocturnal erections, testosterone balance, and sexual performance. And this is not just short-term. Over time, regular use of calming acupressure combined with slow, diaphragmatic breathing has the potential to reverse mild to moderate ED, naturally, without drugs. Let's move into the technique together. First, locate the base of your second finger and follow a line down toward your hand. Right beneath the small bone there, you'll feel a soft hollow. Press this point firmly with the thumb of your opposite hand. As you hold it, try to relax into the sensation. You may notice changes in the areas behind your eyes and sinuses, hallmarks of vagus nerve engagement. As that signal travels toward the brainstem, we begin to see a widespread regulation of nervous system tone, vascular dilation, and improved oxygen delivery to peripheral tissues, including reproductive organs. Now let's move to the fleshy part of your palm called the thenar eminence, the mount beneath your thumb. Find a thick band of tissue there, tender to the touch. Apply direct pressure. This point is linked in traditional practice to the lung meridian, but it also connects to vagus nerve tone and breathing patterns. Now inhale slowly through your nose and exhale gently through your mouth. As you continue to hold this point and breathe deeply, you'll likely notice your breathing opens up, oxygen moves in more freely. This increase in oxygenation is not only relaxing, it also directly supports blood vessel dilation throughout the body, including difficult-to-reach vascular beds like those in the pelvic region. Strong, healthy erections require adequate blood flow, responsive smooth muscle, and nitric oxide availability. Balanced breathing and stress reduction enhance all three. Now trace a diagonal pathway across your palm, toward the outer side of your hand. Beneath your fifth finger, locate the depression inside the outer crease. This is a powerful point traditionally associated with the heart meridian. As we apply pressure here, you may notice your heart rate slowing slightly and a growing sense of calm wash over you. Take a breath. Feel the body responding. This deeply calming point quite literally sends afferent electrical signals to the brain, processed through the limbic system and hypothalamus, which then signal back to the cardiovascular and reproductive systems. Changes in heart rate variability and blood vessel tone are soon to follow. This is not hypothetical. Modern imaging techniques and heart rate monitors show these measurable changes in real time. Now, our final point lies near your wrist, just inside the small protruding bone on the pinky side of your wrist, known as the pisiform. Slide slightly inward toward the center of your wrist until you drop into a little hollow. Press firmly here. You may start to feel heaviness behind your eyes, and your breathing will naturally slow. This point essentially anchors the entire sequence and adds the final push to bring your nervous system into equilibrium. Again, I want to emphasize how this practice, quiet and subtle as it may seem, has a far-reaching impact. Parasympathetic activation increases testosterone production, improves sleep quality, particularly REM cycles where erectile episodes occur, and enhances the elasticity and responsiveness of blood vessels feeding the penis. When you sleep well and breathe deeply, you'll likely wake up with firmer, more consistent morning erections, a key biomarker of cardiovascular and sexual health. These physiological events are signs that your hormonal axis, circulation, and nervous system are communicating properly. You can perform this sequence at night to promote sleep or any time of day to reduce stress and support blood flow. If you don't notice immediate results, don't be discouraged. Subtle neurological recalibration can take time. Make it a habit, and you may be surprised how many aspects of your health improve, including your sexual performance, confidence, and sense of vitality. And here's something fascinating. Even after you've stopped pressing the points, those neurological and physiological effects can persist for 30 minutes or more, continuing to work in the background, supporting all the parasympathetic functions that your body often doesn't get enough of in today's high-stress world. Gentle, powerful, natural. This, in many cases, can be the missing piece in your recovery from burnout, brain fog, or erectile challenges, restoring your energy, sleep, libido, circulation, and inner calm. Thank you for joining me today. I'm Dr. Fiona, and I truly believe that your body has everything it needs to heal, strengthen, and thrive when it's given the right signals and support. Take care of yourself, make this practice a daily habit, and as always, make it a strong, vibrant, and connected day.